for now. The Islamic Medical Association of SA says that prohibiting Muslim nurses from wearing headscarves feels like an attack on their religious belief. It follows the Health Department's proposal to ban nurses from wearing headscarves while on duty. Now, there are some other proposals. I'll mention them here. We're not going to unpack this part, though. It includes longer skirts and dresses for female nurses, no brightly coloured wigs, and extensions are allowed. Also, moustaches and beards for men must be neatly trimmed. We'll put the beards and the moustaches away for a moment. Let's talk about the headscarves. Dr. Irshad Moosa, President of the Islamic Medical Association of SA, joining us now. Dr. Moosa, good afternoon. Good afternoon to you. Appreciate the time. I can't understand how this is even a discussion point. That's like asking a Christian nurse not to wear a crucifix under her uniform.
Yeah, good afternoon, Gareth. Let me start off by saying that the Islamic Medical Association of South Africa is an NGO, and we've been in existence for the last 40 years. And we represent over 2,000 healthcare workers from the various backgrounds, from public sector and health sector in various fields. And that we've, over the past few years, enjoyed quite a nice working relationship with the Department of Health. And we've assisted on a lot of projects to assist them provide healthcare services to the needy and the underprivileged. So we find that while we respect and appreciate the need to have a uniform, standardized, professional attire at the workplace in the healthcare setting, we have severe reservations about the ban on wearing headscarves while on duty. We, as you know, headscarves holds an immense significance, both culturally and from a religious perspective, as it symbolizes identity, it symbolizes modesty, and obviously personal faith. And as you quite rightly said, it's not only for Muslims and from an Islamic perspective, but also for other religions and other cultures. So we can't understand why the department has decided to continue with this prohibition of wearing of headscarves for nurses while on duty.
Is it a proposal at the moment, Doctor? Do you know, or is this actually being enforced? Sorry, forgive me if I had that wrong. Is it currently enforced, or is it still just a proposal from the Health Department?
So I received on my desk a directive, which, from my understanding, is it's something that's been not a proposal, it's not a draft, it's a directive that was being implemented in July of 2023. So it's, from my understanding, it's not a proposal. It's a directive that's come from the Department of Health to all the provinces throughout the country.
Any idea how this could affect? I'm trying to imagine, Doctor, in a world where wearing a headscarf for professional and, I beg your pardon, religious reasons, not professional reasons, they're professional nurses, but for religious reasons, would that affect someone's job? I'm trying to get a sense of what could be the rationale behind this, but it's not making sense to me.
No, it doesn't make sense to us as well, because firstly, if you look at, there's no empirical data to suggest that the headscarves will interfere with the duties, the way it's worn. Secondly, there's no empirical scientific data to suggest that headscarves will increase the risk of cross-contamination, as opposed to not wearing headscarves or wearing other forms of headgear. And if you look at it, there's millions of nurses throughout the world, in other parts of Africa, in parts of Europe, South America, and Central Asia and the Far East, who wear headscarves daily while on duty as nurses. So from a scientific perspective, I cannot see any reason why there should be a ban on headscarves.
What's the communication going forward now, Doctor? Because, as you say, it sounds like this has been put into place at the moment. This document, even on your desk earlier today. Are you taking this up with the department? Are you being ignored? Is it something that you feel they could be open to discussing? Or is this the proposal, this is what's happening, and now everyone must just accept it?
Well, we have written to the Department of Health, and we have received acknowledgement of receipt of the letter. However, we haven't had any sort of engagement with them, a discussion around this. We feel that the Department of Health should have maybe just had some engaged with the various stakeholders and had a more informed decision-making process. So we're hoping that with the exposure and the discussions that we're having now, that they would reevaluate the current directive and yeah, look at it more from a more inclusive and perspective, you know.
Yeah, it makes me wonder as well. You don't know offhand, Doctor, if those who are the decision makers at the Department of Health, do you know if we have anyone who is Muslim at the higher echelons of the health department? I wonder if perhaps isn't there's some ignorance that's being pushed through with somebody in the department not having even thought about this. Do we know if we have any high-ranking Muslim practitioners in the higher echelons of the health department?
I'm not sure. I can't answer you on that. I don't have any idea.
And if this were to be pushed through despite your reservations and despite your concerns, Dr. Moosa, how would you feel is the best way to handle this if the department comes back, even after the acknowledgement of your letter, saying, look, this is the regulation, this is what we're doing? How would you view that? What would you do?
Look, the one option that we have is to obviously go the legal route, and there has been a precedent set by a case in 2021 where one of the employees of the South African National Defence Force took her employer, the South African Defence Force, to court regarding the prohibition of her wearing headscarf at work. She was successful, victorious. The case was dropped. So there is that precedent that's set. So I mean, we wouldn't want it to go to that extent, but I mean that is an option that we have, but obviously we would rather have them relook at it and maybe reevaluate the whole thing and amend it so that it suits everybody concerned.
Yeah, absolutely. Dr. Moosa, thank you for bringing it to our attention. What I'll do is we'll make sure we get some reaction from the health department on this. We'll certainly start chasing them down, put this question to them and try and get some clarity, and hopefully we can get the conversation going. Dr. Irshad Moosa, President of the Islamic Medical Association of South Africa, joining us this afternoon. It's heading up to